Hello and welcome back to Healthcare Experience Matters. Joining us today is Jan Gnida. She's a Senior Vice President of Research Operations for PRC and a familiar voice on this podcast. Katie Owens, co-founder and president of the Healthcare Experience Foundation. Katie, I'm going to let you kick it off here. Just introduce yourself if you don't mind and take it away.
Sure. Hello, everyone. Welcome back. I'm so excited for today's topic as we are focused at the Healthcare Experience Foundation on assuring every person is equipped to deliver and receive an excellent experience. Today's topic really hits home and get to share some new insights with my dear friend and colleague, Jan Gnida, who, Jan, I think we've had the opportunity to work with going on almost 5 years now. And when I think about above bar, national thought leader on HCAHPS, CAHPS, measurement to action, you have just had the opportunity to work with probably over 1,000 organizations. And it's really rewarding to me that we've been able to study the experience across since the beginning of the pandemic together.
Yeah, thank you, Katie.
And I wanted to ask you both about some of the patient experience changes that have happened since 2020, the start of the pandemic. Some really interesting data, to say the least, about what's been going on. So I'll let either one of you jump into it right away. Why has this interested you so much in studying the patient experience changes since the pandemic?
If you can remember way back to early 2020, which seems like hundreds of years ago, and when things really started picking up with the pandemic, we all just felt like we lost our footing. And that's true for those of us in data collection as well. We, took a beat to say, should we even be talking to patients at this time? Do hospitals even want us to talk to their patients at this time? And it was really, unsure footing for us as well. But we're so glad that we were talking to patients through that period. And since then, because it gave us another line of sight into what was happening and how patients were feeling, just how the public was feeling. So what we noticed, one of the most interesting things very early on, when we looked at the April to June of 2020. So this is when we are all stay at home and school is done and we're going nowhere. Our response rates went up a lot because guess what? People were home. And they had time to answer the phone because they weren't going anywhere. And they were thrilled to talk to somebody who wasn't already in their household. So we got an opportunity early on to talk with a lot of patients. And what we heard then was a lot of appreciation for what the healthcare workers were doing in their communities, what they were doing for those patients themselves when they were going to receive care. We saw scores going up. Patients were, I think, showing their appreciation and maybe giving some grace to the healthcare workers that they knew at that time were, just operating in unknown waters. Since then, though, we've seen the scores come down fairly significantly. I think over time, as just as all of us started to grow tired of staying home and wearing masks and getting vaccinated and all of those safety measures we were taking, as our doctors and nurses and staff were growing incredibly weary from the long hours and difficult circumstances they were working in, it's not unreasonable to expect that our quality of care declined, and it's not unreasonable to expect that patients observed that. So when we were looking at the HCAHPS overall rating question, so that's asking on a 0 to 10 scale, overall, how would you rate your experience at this hospital? Best ever is a 10, worst ever is a 0. We've seen that number coming down, particularly since I would say January to March of 2021 is when it really started on a steady decline. And it's been kind of hovering since then, but hasn't really come up much yet. We certainly aren't back to where our scores were before, and I think it's going to take a long time before our healthcare system and the way we deliver care rebounds. I don't even want to say rebounds, but just recovers to where we can concentrate and provide the patient-centered care that we know so many healthcare providers are wanting to give to their patients. What we've seen too over the last 3 years, and we've got a visual of this that we'll include here in the video, is that the gap between those top performing hospitals and our average hospitals has been increasing. So, what we noticed early on was that high performing organizations were not seeing their scores fall as much as those who were in the middle of the pack, we'll say. We typically looked at the 75th percentile hospitals compared to the 50th percentile hospitals. And, it seemed that those high performing hospitals were weathering the storm better. They were still seeing declines too, but not as much as those who were in the middle of the pack. What we noticed also, and because the middle was moving further down than the top, that gap was getting wider, and it's been pretty consistently wide, through 2021, 2022. We noticed, interestingly, in the first quarter of 2023 that it got wider. The 50th percentile had come down a little bit. The 75th percentile had actually gone up. And we were hoping, maybe this is a positive sign. We're going to start seeing the trend, and it wouldn't be unreasonable for high performers to be leading that trend. But then when we looked at data from quarter 2 of 2023, we saw maybe a bit of a correction. And at this point now, finally, that gap has returned to where it was before the pandemic, where there's about 6 points difference between the 75th percentile and the 50th percentile. Our middle of the pack, our 50th percentile hospitals are coming up. I think our higher performers are, they're kind of middling. They've been hovering for the last several quarters. I think, in a good place, but maybe unsure about how to take that next step and move forward.
Yeah. Katie, was there anything you wanted to add to that?
We were in March of 2020 looking at just the dramatic and immediate impact that hit our hospitals during the first phase of the pandemic. Jan and I knew this was something that was going to be really important for us to be intentional about measuring for, at that time, an unknown and seemingly forever trajectory of how long we would be in such a state of turmoil. And what you can really see if you back up before the pandemic, and gosh, this is HCAHPS has been in place for all of its pluses and challenges for, gosh, the better part of 15 years. Mm-hmm. And so you would see improvement quarter in, quarter out, year in, year out. We've always had the coaching mantra of, if you're not performing better in the HCAHPS database, you're falling behind. And once we got that initial bump at the start of the pandemic, we have experienced more volatility in patients' experience of care than in the prior 15 years of measuring HCAHPS. And at the end of the day, that's a reflection of the volatility across the entire healthcare experience. Over 100% of hospital staff have turned over in the last 5 years. 95% of that turnover has been voluntary. We're also seeing in our other research that the national databases for employee and physician engagement are decreasing. So the fact that the patient experience has not regained the pre-pandemic levels to us is something that's really important for us to not only continue to monitor and also equip organizations with strategies to kind of stabilize, which we're starting to see, and I know we'll share more about in a moment, and regain that momentum.
Yeah, and we've talked a little bit about kind of what has surprised you about the patient experience trends that the research has shown us since the onset of the pandemic compared to the pre-pandemic levels. Was there any other surprises that we wanted to make mention of?
I want to just, follow up on what Katie was saying about volatility. And I would say what's surprising is that it's not predictable anymore. the HCAHPS results, whether we were looking at national, published by CMS scores, or just looking at the hospitals that are working with PRC, I could make a reasonable guess from quarter to quarter. Oh, it's going to go up a little bit. It's going to go down a little bit. And, I do still feel like we're in a period of, I don't know what's going to happen next quarter. It's up and it's down and it's up and it's down. And I think, hospitals are trying to get their bearings. Again, I've talked with a lot of clients over the last 6 months who said, you know what, we just have to go back to basics, to the turnover point, that Katie made. There's so many new people, either new to healthcare or new to our organization, who are in the mix now, that we've got to reset on some of those basic, proven patient-centered behaviors that will, stabilize us and then give us the foundation to improve from there.
These research findings that we've just talked about, now I want to kind of get to the actionable part of today's conversation and talk about what health systems should be doing in light of all these findings we've been talking about so far.
Sure. So here's an additional finding, and whether this is surprising or not so surprising, Jan and I thought this was really important to know in the research, and that's despite all this volatility, when our team runs the regression analysis and looks at what are the biggest predictors of whether or not a patient is going to say, this is the best hospital overall, despite all of the ups and downs that you'll see in the data, the behaviors that are important to patients has been extraordinarily enduring. And so the three most prominent behaviors that patients want to see is teamwork. They want to know that the doctors, nurses, and staff are working together to care for them. They want to feel that they've had a safe experience in the hospital and the emergency department. And they want to feel treated by staff, which is anybody who wears a badge, with a sense of courtesy and friendliness. And then from there, some of those same things, secondary drivers are things like listening, considering patients' preferences. So the behaviors are very, very enduring despite the volatility. So for organizations looking to improve, it's focusing on how do we make that caring visible? How do we reinstill consistent practices around patient-centered communication, narrating our care? Relationship rounds is a big focus area for our team from an improvement standpoint. And then supplementing our HCAHPS surveys with real-time measurement, whether that's text or email, so that you're equipping leaders with on-the-spot information to validate that our patient experience strategies are improving. All those things within the walls of the hospital are important. And then really appending to our patient experience strategy, where we're seeing tremendous improvement and momentum, our discharge phone calls and our Cares Connect program are making statistically significant differences in patients' perceptions of care, safety, their degree of efficacy with safe transitions home. So to me, those are some of the coachable, teachable moments as we've looked at some of these unpredictabilities in the measurements.
If I can just add on to the safety point specifically, I was looking back through all of the analysis and findings and research we've been looking at over the last 3 years, and came across a great document I had forgotten about, where we were looking at patient comments. Most of the HCAHPS survey, as you know, is closed-ended questions where patients are given a scale to respond to, but we ask additional open-ended questions at the end of the survey so the patients can tell us what's on their minds. And as Katie mentioned, safety has long been a key driver according to our statistical analysis, but prior to the pandemic, not something people talked about very much. So it was difficult to look at comments and understand maybe what patients were thinking of. When we got to the pandemic, they had lots to say about the safety measures they saw happening. For obvious reasons, patients were much more attuned to paying attention to those things. And I was looking back at, some of the things people were talking about. They were talking about the spaces they were in and noticing the cleanliness. They were talking about things they had to touch and suddenly things they didn't have to touch, talking about the words that we used to help them feel comfortable that we were keeping them safe. And all of those things, honestly, are things we could still be doing to ensure that patients know that their safety is a top priority for us. And so, the list of lessons learned from these last few years could go on for days and days and days. But I think there's some real opportunities to keep some of these behaviors that felt like modified behaviors and keep them as things that we continue to do going forward.
I want to give you an opportunity to give us any of your final thoughts or anything else that you wanted to mention before we wrap up. And then also, I was curious why you are so enthusiastic about keeping your eye on these data as the months roll on, because spoiler alert, it's so unpredictable, but why else are you very excited to keep your eye on this data?
For me, I'm just curious to see how long is it going to take us to get back to where we were. I think we're starting to get on an upward slope, but we've still got 4 or 5 points to recover in order to see scores where they were prior to the pandemic. And that kind of, gets us back to baseline, so to speak. And then we can start building from there. So, every quarter I look, is this the quarter? Is this the quarter? Can I see a 2-quarter trend of scores going up? And we're not quite there yet, but certainly those are opportunities for celebration, not only for looking at our data set as a whole, but also for hospitals individually. Anytime we can show improvement because things have been so up and down, if we can get some trends going of improvement, that's momentum that we can build on, and hopefully celebration that we can share with our staff to reinforce, the why of what they're doing.
Those of us in healthcare, we really go to work every day out of a commitment or a call to caring. And for us, as we look at this data, we think about through the different stages of the last 3 years, just this year, the courage, the compassion demonstrated, and all at a time where there's a high degree of process instability, high degrees of fear, frustration that's really carried forward. And for us, it's an opportunity to really stay forward, the retrospective look, to stay forward thinking and to make sure that we're encouraging our team members, being transparent with the reality of patient feedback, and we're inviting them and involving them to be a part of the solutions. Here's our results. Let's talk about what listening looks like. Let's talk about what safety looks like. How do we make sure patients know what safe care looks like? To us, it's an opportunity to redesign the healthcare experience, and look forward to the day where, Jan, you and I feel like, all right, we've reached a degree of stability. Yeah. We're going to summarize all of this and continue to publish. But we look forward to saying, all right, we feel like this body of research has served its purpose.
Yeah, exactly. We began doing a podcast or webinars around in the middle of 2020, I think. And we were going to do one to just show people, here's the early returns and what's happening during the pandemic. And then we did another one, and then we did another one. And we said to ourselves, how many of these do you think we're going to do? And yes, we'd be happy to put the back cover on this research and move on to other things.
Yeah, definitely understand that. And we might just have to do this again in a couple quarters and catch up with where the data is at that point. And hopefully it's good news. But I will just say a programming note. If you'd like to see the patient experience changes graphic that shows all this, please make sure to check the show out on YouTube. I will put a link to that in the podcast description so you can visualize some of what we're talking about today. Mm-hmm. Our guest today has been Jan Gnida. She is a Senior Vice President of Research Operations for PRC, and Katie Owens, co-founder and president of the Healthcare Experience Foundation. Thank you both for your time.